Hi, I'm Don Patchen with Sarasota County Communications. Thanks for tuning in to Facebook Live. Sitting here in the Access TV studios here at Sarasota County, and joining me today is Chuck Henry, our Director of Health and Human Services for Sarasota County. Thanks for being here, Chuck.
Well, thanks for having me, Don.
Well, we're glad you're here, and a lot going on in the community, a lot going on around the nation, but we just thought it'd be a great opportunity to give an update what's going on here in Sarasota County from your perspective, from the Department of Health. So let's jump right in. As I just said, that there has been quite a bit of an uptick, and we're seeing on the news nationally, in the state, and Florida seems to be a topic that keeps coming up. So can you give us just an update what's going on here in the state of Florida and specifically Sarasota County?
Happy. I'm sure everyone's aware there has been an increase in the number of cases being reported, both statewide and local, and that's something that we're watching closely. Not totally unexpected as we began to move from a totally lockdown community to reopening the economy and moving about. People have more contact with each other, so there was an expectation that we'd see more cases. Things are moving a little bit more rapidly than we would like, but it's not just cases that we have to watch. And so as we talk this morning, I'll share some of the other data points we're looking at and why that's important in our community.
So you talked about the data points. So as you and I were talking about before we went on Facebook Live, is that there is a surge in testing and how that affects the positivity and how that's something that you want to monitor, or everybody, the Department of Health wants to monitor how it impacts our community related to hospitals. Can you want to give us a little bit of update in that area?
Sure. Really, before I go there, though, I think it's important for the public to be reminded all the reasons that we continue to stress wearing a face mask when you're out in public and can't social distance. And speaking of social distance, the easy way to determine that is 2 arm lengths. And Don, if you could, so if you're 2 arm lengths away, then you're 6 feet away. So when you can't social distance, you should have a mask on, especially if you're in an indoor public area or an area where you can't guarantee someone won't wander up right behind you. If you're outdoors and you can keep the distance, then masks really aren't necessary. The whole concept of a mask is to contain the virus. If you yourself happen to be ill and asymptomatic, meaning you don't have symptoms, then you could be spreading the virus, and the mask helps contain that virus and stop the spread. The mask also does provide some limited amount of protection for you, but mainly the purpose for masks is to protect others around you. So we see that as a responsibility of all of us as citizens to protect our community and protect each other, especially our vulnerable population.
Well, since we're on the mask topic, you have your mask, I have my mask here. We took them off to do this, and as I come into work, you know, I wear it through the common areas of our county building here at Sarasota County, and I know you walked in through our lobby this morning wearing a mask, but we have to take it off for this, but we're 6 feet apart. It's really important for folks to understand how important it is to protect themselves or protect others around them.
Well, I can certainly say from my perspective, I wear my mask when I'm out in public, when I'm in common areas of buildings, especially if I'm in an area where I can't be certain that I can be social distanced. It's a little bit safer outside than inside, but people should be mindful of the distance between themselves and others and have the mask handy and ready to put on. At the same time, hand washing continues to be really important to reduce the spread of virus, and then limiting your social circles. You know, if you have the group of people that you see frequently and you're around more often, the smaller that group is, the less likely you are to encounter the virus. So that's opposed to being out at the beach or out at clubs where you may have lots of people from different areas, maybe even some visiting from out of town or out of state that you may be exposed to.
And you talked about hand washing, and a lot of folks have a gel or a spray or some kind of hand sanitizer. I carry a bottle on my backpack, so if I get to a point where I'm like, I may have touched something, that I should make sure I have an ability to quickly sanitize my own hands before I move on or touch my own face.
Sure, and that's a new habit we're all getting used to in our new reality. When we're out, say we go in the grocery store, first thing important is check the label and make sure it's at least 60% alcohol content, because that's what's going to help you with sanitizing. And of course, hand washing is always better when we have access to soap and water.
Right. So let's jump back into some of the data regarding Sarasota County. As we talked about, you mentioned beforehand, there is a surge in testing. How is this impacting our community and the positivity rate?
So we are seeing a lot more people tested with the University Town Center drive-through and the Robert L. Taylor Walk-Up Center. There's a capacity to do just over 1,000 tests a day, just from those two resources in the community, plus other resources coming online at CVS drugstores, at various healthcare providers. The health department does pop-up testing. So lots of testing happening. And as you might expect, when you test more people, you're going to find more positives. But we have seen a real shift in the demographics or the age of those testing positive. Through most of this pandemic, since late February, early March, our median age in Sarasota County for a positive test has been well above 60 years of age. In the last 3 to 4 weeks, that's rapidly come down. And in the last 2 weeks, the average age is about 38. So it's quite a difference.
That's a huge difference.
And the importance of that difference and the importance of looking at the data as a whole before we get super alarmed. And I'm not trying to say we shouldn't be cautious or we shouldn't be concerned, because I think we all should be cautious and concerned. But the numbers are increasing. The percent positive of the tests that we're doing, which is what percentage of the tests that we conduct are negative versus positive, and our percent positive rate had been running less than 1% in Sarasota County on a week-by-week basis, and that has climbed now to just over 6%. So it's climbed significantly, as well as the number of cases that had been running in the average of about 10 cases a day, and now that has increased to 45 to 55 cases a day when we average it out. Both significant increases. Where we're not seeing the increase is in hospital admissions. We are seeing slight increases there, so we're watching that closely, but I mention that because when you think back to when this pandemic started, the whole process of staying at home, social distancing, was put in place to protect our vulnerable population and to keep our healthcare system from being overwhelmed. After watching what was happening in Italy, where there were so many patients in the hospital, and for that matter, in fact, in New York City, so many patients got sick at the same time that the hospital was overwhelmed and couldn't provide the very best care. So our goal through this pandemic has been to ensure that our healthcare system stays viable, that it's not overwhelmed, and so we continue to watch the hospital populations, both the ICU admissions and regular hospital admissions for COVID-19. We continue, as of today, to have plenty of capacity in our hospitals, but again, I'm in a concerned and watchful mode because we do see slow increases with the increased number of cases. We're seeing some increases in hospitalization, but our younger population tends to have less severe symptoms and less severe outcomes from the virus. And so it's really, my message for the community would be, if you're in the vulnerable population, which means if you're over 65, and I'm pretty close to that number myself, then you're more at risk. If you have underlying health conditions, especially respiratory conditions, then you're at greater risk. If you're in those groups, then you should be especially vigilant about staying home as much as possible. When you do go out, wear your mask when you're in public and can't stay social distance. Use your hand sanitizers, wash your hands frequently, because the average age of those hospitalized is typically 70% of our cases have been over the age of 55. The majority of those over the age of 75. So those are factors that make a big difference in the severity of the disease.
Well, I think that's a key component, and I want you to reiterate it. The reason we're social distancing, the reason we're asking people that if they don't have to be out, to stay home, to wear a mask, to use hand signs, impacted enough that we can preserve the ability for our healthcare system to take care of those who really need it.
You're absolutely correct, Don. The virus is out there, and it is a concern. It is dangerous for our community, and we do have young people that die from the virus. I think just last week, a 17-year-old in Florida unfortunately succumbed to the virus. So age is not a shield that protects all, but we see more negative outcomes with our older population. Stopping the virus from spreading is really what we're trying to do. If we can keep the spread of virus at a lower level throughout the community, then we can manage the illnesses that go to the hospital, we can manage the symptoms, and we can also continue to keep the economy moving, all of which is critical to our community.
Something we should mention, we're a little over a week away from a big holiday in the United States, July 4th weekend. We will see probably a large mass of people going to events, I know, or just going to the beach or family gatherings. Knowing that, what advice do you have to reiterate to our viewers about holiday weekends or how it impacts your just everyday life?
That's a great comment. And people get tired of me preaching, wear your mask when you're out and can't social distance, wash your hands, try to avoid contact whenever possible. But that mantra still applies even to family gatherings. In fact, consistently throughout this outbreak, we see example after example of large family gatherings where families come together either for weddings or for funerals or for holidays, and maybe there's somebody that's asymptomatic, meaning they have the virus but no symptoms, that spreads it. And when families gather, usually it's multi-generational, and then those that are vulnerable within that group end up in the hospital or worse, and it's really tragic for families. And so if I could stress anything as we approach the holidays, be mindful that the virus is there. It's part of our lives right now until a vaccine is available, which I think is quite a ways away yet. We all need to be careful. We all need to practice that social distancing, even in family gatherings, and do it out of love for one another.
So before we wrap up, I know I always pitch our county call center, 861-5000, but I know there's a number that you recommend people to call if they need information regarding if they think they have the COVID.
Right, we have a COVID-19 information line, 861-2883. It's staffed Monday through Friday, 8 to 5. We use that line for people that want to make appointments for testing when we're doing our pop-up testing, but we also use it to provide information to the community when they have specific questions on COVID.
Well, Chuck, I want to thank you. It was a lot of information, but the underlying theme is just be diligent, be careful, wear your mask, wash your hands, social distance, and stay out of large groups. I think that's just the advice we got to keep pushing out there.
It's the continual message, and whether you're in a community that has strongly encouraged masks or has mandated masks, or a business that has mandated that masks are required to come in the business, I think wearing of masks is good for public health, and I support any actions we can take as a community to protect each other.
Well, since this all started, Chuck, and we've spent a lot of time together at the Emergency Operations Center with the rest of the team, and I want to speak from my side, from our team here at Communications for the county as a whole and the residents. We are lucky to have you and your team leading us on this, and we do appreciate your expertise and your willingness to do things like this to educate the community. So thanks.
Well, thank you, Don.
So thank you for tuning in to Facebook Live. As always, you can get the latest information about county services by calling 861-5000. That's Monday through Friday, 8 to 5. Or go on to all of our social media channels and, of course, scgov.net. Thanks for tuning in. Stay safe.